Bit of housekeeping, today's event will be recorded. It will be available publicly on our webpage and other media. Today's webinar, everybody will have their microphone muted during the presentation, and make sure that your volume is raised all the way up so that you can hear very well. If you have any technical issues, please send a message to the Hispanic and Latina Behavioral Health COE on the chat box. And if you have any questions for our panelists, please also use the Q&A tab in the menu. Just write down your question and click send. And we will address those questions in the right moment. Today, we're going to share a copy of the presentation through the chat at the end of the presentation, and we will also make it available to be downloaded on our webpage. You will find it under today's title, and the recording will also be made available in our YouTube channel. And something very important, once we complete the session, please complete the evaluation of this event. There will be a link that you can click on through the chat, or you can scan the QR code at the end of the presentation in order to complete the evaluation, so you can receive the certificate. You must be at least 70% present during the event and fill out the evaluation at the end. Our mission is to advance and support the sustainability of behavioral health by promoting community-driven, culturally grounded, and person-centered prevention, treatment, multiple pathways of recovery, and recovery support for Hispanic and Latino communities. This is our mission that is rooted in cultural issues. In this session, we're going to have a group discussion, and it will be a safe space that everybody can share their ideas and experiences. Please, we want you to be open and honest in your communications. Also, please be respectful of others' approaches and experiences. Please be aware that we all come from different backgrounds and have unique perspectives. This is very important. In this group discussion, we will consult and collaborate. So please feel free to consult about challenges in the clinical environment, your achievements in the clinical environment. It's a collaborative environment that everybody can learn from each other. As far as confidentiality, please be careful not to share any confidential information about your patients or participants. Privacy is of utmost importance. Also, be aware that we have certain key questions that we will take into consideration during the session. So think about what motivated you to attend this dialogue session. Also, how would you rate your knowledge on culturally responsive practices with Latina clients? Scale of 1, no knowledge, and 5, extremely knowledgeable. Also, think about what have you found most challenging when establishing dialogues around culture and identity with Latina clients. And number 4, please, how have you adapted your approaches in therapeutic space to be more culturally sensitive? How has it benefited your clients? Now we want to give a warm welcome to our resource, today's panelist. It is my pleasure to present Evelyn Gomez, PhD, Director of Trauma Response Implementation. She's an associate professor at the University of Colorado, at the medical school there. She is also a licensed bicultural bilingual clinician with more than 15 years of experience, covers abuse, youth negligence, trauma, and evidence-based treatment. She also provides consultation because she has a lot of experience with equity and justice with diverse populations that includes adults, young children, babies, and every family member. She has been implementing evidence-based treatment for more than 15 years in under different systems. Dr. Gomez is the lead researcher in several projects, one of which is the implementation of the mental health support in the schools with the Colorado Department of Education. She's also a developer and a trainer of a 7-hour curriculum. And she has received many leadership awards within the faculty. And she has belonged to various national and local networks of clinicians related to trauma and national institutes. You can communicate with her at evelyn.gomez at countshoots.edu. And now, without any further ado, I pass the mic to Dr. Gomez so she can continue with today's discussion. Welcome, Dr. Gomez. Hi, Jasenia. Hello to everybody. Thank you for inviting me today. I'm going to give you a little bit of didactic information that you probably are familiar with already, especially if you've been working with trauma issues. And we hope to dedicate at least 20 to 30 minutes with different activities and applying several practical and critical thinking issues. But before all that, I wanted to have a mindful practice. Mindful practices help reduce stress, anxiety, depression, even improves focus and attention. So we're going to give it a go. Please close your eyes, turn off your cameras. I can't see anybody, so it's okay. I can't see what's going on. So just make sure that you're sitting down in a comfortable place, that you can maybe recline or lean back and make yourself comfortable. I want to recognize that this may not be easy for everybody, but I would like you to try. Try just to invest a little bit of time into this, just to make sure that you're comfortable, sitting down or lying down, so that you can feel relaxed, that you feel supported, that you close your eyes and turn off your cameras. And this will help you to focus your attention within your insides. Start to deeply breathe in. Deeply breathe in through your nose. Let your stomach swell with all that oxygen. Now exhale very slowly. Let the air out. Let the air out through your mouth or through your nose and liberate all tension that you have on your body. Notice the sensation of the air as it comes in and out of your body. Deeply breathe in and breathe out. Let go of all your air. Now, place one of your hands over your heart. And this can help you to create a warm sensation of connection. Continue to deeply breathe in and breathe out. Focus on your breathing and the calmness that is falling over you. Do it once more. Breathe in deeply. Focus on your breathing and the calmness flowing over you. Let go of all the tension that you feel in your body. Do it one more time. Breathe in deeply, slowly. Focus on your breathing, the calm that is falling over you. Let go of all the stress and the tension that you feel in your body. And when you're ready, open your eyes slowly and take a minute to think about how you feel. We're going to come back into the room, stretch yourself if you need, breathe in once more, and let go. And now we start today's activity. Thank you for doing this with me. These breathing exercises can activate the parasympathetic nervous system, which is responsible for rest and relaxation. And it's a counterpoint to this struggle or fight and flee response. It reduces stress, and I hope you can benefit from it for the rest of the day. Why are we talking about trauma today? Approximately half of all the adults in the US report at least one traumatic event in their life. And more than 2/3 of children report at least one adverse experience before they turn 16. And we know that the effects of trauma can be mitigated through holistic approaches with awareness, mindfulness. It's important for us to recognize the impact trauma has on a patient and their well-being. One of the reasons is that we're addressing trauma at schools is because research has shown that there's a huge increase in disciplinary actions, punitive actions like expulsion for children who have behavioral issues, without recognizing the effect that traumatic experiences have on these children. There's no support for these children and their families that go through these traumatic experiences. So SAMHSA created what we see here are called the 4 R's. We have to realize the diverse pathways to recovery. We recognize that these experiences are accompanied by specific symptoms, and they respond to an integration of public policy to avoid re-traumatization. So to recognize the trauma systems in the school environment recognizes adverse experiences that may affect learning, well-being, and students' health. This often results in a challenge like anxiety, depression, and difficulty establishing relationships. So let's define trauma. Trauma comes from the Greek word, which means wound. So we're talking about a psychological wound. It's a lesion, a wound, experiences that result in wounding, creating a wound in your psychology, and points to a lack of function in the neurophysiological system that refers to emotional and cognitive and behavioral processes that are overseen by the brain. Trauma is the unregulated response of an individual to this event. And the subjective experience of the individual is more relevant than the objective facts of the event itself. What is trauma for one person may not be traumatic for another person. Now, the effect on how it expresses itself can vary and affect the development stage of the individual, especially when we're working with students. So think about this. While the younger the student, the child, the more critical it is, because it could interrupt the development, the early stages of development of the children. When they're developing their identity, they could affect self-perception and relationships. And we see different types of trauma that you may have seen in different examples. These are the main ones: the acute trauma, chronic trauma, which is a repeated prolonged traumatic event, And the complex trauma, which is a response to traumatic events when it happens at an early age, and also when it's related to issues with a guardian or parent. When the brain receives a threat, it activates the fight or flee response and exacerbates those psychological changes. So think of a student that is, or a kid that is being bullied and suffers domestic violence and suffers negligence, and then they are punished at school for not finishing their homeworks. These kind of threats may create emotional responses like fear, of being upset, irritability. They're hyper aware, may affect their heart rhythms. They're confused. Their thinking is fragmented. They're struggling with memory, with focus, and it becomes difficult for them to process information. So this prioritizes what is care, and they start to work by regulating their emotions. Similarly, when we're fleeing, the body may be may freeze, and this may express like numbing, emotional numbing. They become distant. They don't think correctly. They don't process the information the same way. Their body feels frozen and unable to react. And it is very difficult for them to react to this. So these responses are coping mechanisms that have an effect in their cognition and emotional health. Now we have the optimum arousal when they feel safe, when an individual is regulated, they have good social relationships, they can connect to others. When they are in this way, they can create established relationships, social relationships, exploratory relationships. They feel calm, they're curious, they are creative, they learn, they grow, and they can retain information better, and they can better do critical thinking exercises and develop certain skills in this regards. So this beyond the survival state, there's a sense of connection and adaptability and personal growth. And that's what we want to aim at, of an optimal arousal, so that our students can arrive at this. If they want to reach this state, they have to feel safe. They have to be trusted. They must feel that they're in a warm environment that supports them. Empathy, to offer empathy, support, to address their needs. And these key things are very important in trauma treatment, so that they feel empowered by our help. And to these best practices in trauma treatment supports the student in positive behavior, and it has positive results, and it helps teachers to respond in a way that lowers their guard and disarms them, if you will, and they are able to exhibit healthy emotions and not be punished for it. When we think about safety, we think about physical and psychological safety, and you have to regulate yourself. I regulate myself, and then it's easier for me to help my students. And you have to regulate. So you have to have strategies like breathing, like we just saw with the doctor. We need a gentle tone of voice, to use the right body language to project that calmness and that safety that they need.
Create clear routines, clear agenda, and slow transitions that will reduce any difficulty. promote trust through empathetic interactions, offer constant help, recognize their feelings, have activities that are fun, creative, and that promote curiosity. This all promotes exploration, creativity, play, and that activates the social system in the brain and also helps promote learning. So empowering them through abilities, using meditation techniques, calming techniques, breathing strategies, this will all help our student in calming their reactivity and achieve a calmer state. And also, it's important to understand who they are as individuals, if their experience, what their experiences are, where they come from. When we have our trauma-informed glasses on, we can be more present and are able to offer more support. When we don't have that, we can judge our students. We might assume that they're manipulative or lazy or that don't respect us and so on. And it's very easy to interpret their conduct this way and punish their behavior. And what that does unintentionally can create more fear and does not help them. We can recognize that these behaviors are actually survival responses instead of judging it as a negative quality of these students. So applying this perspective helps us to respond to these things with more curiosity, empathy, and support. So when we have our trauma-informed glasses on, we can see beyond and participate and help in the healing and in the growth. And this is what we aspire to for our students, our schools, and our teachers. And that is what we want to create in our classrooms and in our school environments. Now we are going to spend a little more time talking in groups, and we're going to have some time to reflect on some of these questions. We can see here that in number 18, there are different activities. You can discuss each session in your group using these scenarios. You can see it in the slide 19, and using it as reference, you can discuss some activities and reflections. We're going to spend about 10 to 12 minutes on this, and then the second part will be to develop a plan that we will implement and use based on trauma-informed. Desenia, I don't know how many people are present here today and how we could divide it. We have 40 people right now, so we can divide them into 3 groups. At least 10 people in each group. And then in a few minutes, you mentioned 15 minutes for discussion. Maybe 10 to 12 minutes. We want to come back later and have a 10-minute discussion as a group. 10 minutes to be able to do the reflexive exercise, and then 10 minutes to discuss the plan. And you don't have to come back right away. You can stay in your respective groups and do both activities. So we will be back more or less at 11:45, at 1:45 p.m. All the participants have the activity that they can download with the document. You can download it, and we shared it here in the Zoom for both cases, and then we will divide into the groups. We will create 3 groups. Hello, welcome everyone. I hope all the participants are coming back to the main room. Welcome back. I was thinking about if there is any way in which each group could report back on what they discussed, any ideas that came up in the groups as you discussed these questions and reflected upon this and developed your plan. Jasenia, can they report out? Can they speak? I'm not sure. Yes, yes, you can do that. We can also see in the chat if anybody wants to write down anything instead of turning their microphone on. Any thoughts, reflections, questions, comments? They tell me there's not much time. We never have enough time. Who says that they don't have the option? Chantal says she doesn't have the option to turn her mic on. And somebody's writing, reach the student and their family wherever they are and support the systems that they have available. Our group discussed the instability of housing, domestic violence, gender dynamics in the classroom. Very interesting, yes. I would like to hear a little bit more about the gender dynamics in the classroom, definitely. And it would definitely require collaboration amongst the different parties and school personnel and other people of the community. Yeah, when we think about supporting the students, we cannot think of just one person. We have to think of what surrounds them, what support systems they have around them. And not just for the students, but for the teachers as well, because sometimes the teachers are a bit at a loss about what they can do, especially if it's something that's been happening for a long time. So the teachers also might need that support from other people. Yes, thank you. They're talking here about how the student is a girl and the teacher is a man, and we're saying that's what happened. Yeah, good point. Yeah, that's a good thing to consider. As a mental health professional, we're always thinking about those things. But in the classroom, right, it's a female teacher, a male teacher, maybe they don't think about that. I would invite you to take these questions with you. And if these are things that you are experiencing, to be able to go and speak to these teachers about it in meetings that you might have, to reflect upon these questions, because I think that, yes, these issues do arise and we don't always have the opportunity to discuss them. Maybe a call to action. We discussed offering trauma-informed courses on all levels, as well as for the parents. Exactly, yeah. One of the things that we do with those principles is not that we just apply them for strategies or just for classrooms, but usually we use them as concepts for the whole system as a whole. It's important to see the system as a whole, not just the students, and just focus on the students and in the challenging behaviors of those students, but also it's about much more. Yes, I think you'll be able to have the slides. Somebody's requesting them. Yes. We're going to send the slides to, yes, we will send the presentation for everyone to have as reference. Any other comment? One thing that I was thinking about the reflection questions is to take into account our own knowledge and our own self-reflection, and how sometimes it's hard if one is within the school to be able to do that right there, right? To identify what are the triggers or anything that activates your own self-regulation, right? We also want to start with our own self-regulation and notice what is happening with us. Is it a trigger for us? What activates it? What is activated within ourselves? We have to explore those things, because otherwise we enter a space where we are probably doing the same thing that the student is doing. And we want to de-escalate that situation. We want to identify what is being activated and what are we activating and what is being activated for us. I don't know if I already said it, but I just read it. The call to action, offering courses, trauma-informed on to all levels. I don't know if I read that already. Will it be available? Will the recording be available for everyone here? Yes, it will. The recordings will be available. And I'm curious, how many trainings or how much training have you received in terms of trauma-informed concepts? Any discussions, anything that came up? Somebody says here that our school system already just started using trauma-informed practices in the past 2 to 3 years, so it's relatively new for some teachers. They also mentioned that they have trainings. Someone mentioned they've had quite a bit of training. So we have different levels here. I am reading here somebody that wrote, I'm a psychologist at a safety net hospital with a diverse population, and we are level 1 trauma. So it's very common to see a lot of physical and emotional trauma. And if anybody asks for resource, if you notice SAMHSA, NSTM is Child Traumatic Stress Network, they have a lot of information for different populations, and it's called the STES National Child Traumatic Stress Network. It says here that somebody took a graduate courses in complex trauma, a course in graduate school. Yeah, so refresher courses that are interactive. Yeah, that's what we've been learning up to this point. Through doing this work, I've been implementing trauma-informed practices for many years in Denver. But what we have learned is that there's a lot of training online, but very few when it comes to the application, the implementation of these principles and practice themselves. Like, how does it look like in practice, be it in a classroom or when it comes to mental health space. So implementation is an important focus, and going to this place of reflection is important. Something that we also offer is reflective supervision, right? Because you dedicate a lot of time to the experience of these people who have experienced trauma. And how, when we do this work, and you have to take care of yourselves as caretakers and professionals that are caring for this population, something that is also very challenging. And so I would recommend doing that kind of reflective supervision to be able to support the work that you are doing. I think that more or less we have responded to all the comments. Thank you for sharing through the chat, and we apologize for not being able to hear you directly. I'm not sure if you could or couldn't turn on your mics, but thank you for everyone that shared your comments. And for your reference, we have sent out the slides. We sent it out through the chat. Thank you everyone for being here with us today, and have a good day. Thank you so much, Dr. Gomez, for this covering such an important subject matter that we've talked about today in this short while. And please, everyone who is present, we are now sharing with you our QR code for evaluation with our link. It is in an English as well as Spanish version, and it's very important for our program to have you fill this out, and we get to see your opinions. The evaluation is very good. It's very important for this program to see your opinions and how we're doing this work, so that we can bring other interesting topics to you that might interest you, and do whatever possible eventually to make that happen. So you can scan the QR code that is on the screen to fill out the evaluation form. It's very short and quick. And in just a few minutes, you can fill it out. And considering that we only have 3 minutes left, we want to invite everyone to follow us in our internet page and social network, or get in touch with us through our email sending a message to info@hispaniclatinobehavioralhealth.org for any technical assistance or any questions or interest you might have regarding subject matter, regarding behavioral health for Latinas. So for everyone who is here and everyone in this field that has been able to be here, I'm so happy to have been able to join you in this session with Dr. Gomez. We hope to have other events related to trauma, just like this one, because it's a very important subject for our providers in behavioral health field, but also for our whole community. So thank you to everyone. Please remember to take those last 2 minutes to scan the QR code and fill out the evaluation form. And thank you everyone again for being here with us today for this event. Thank you. And now I will leave the evaluation form on screen so that you can, in a few minutes, be able to fill it out through the link and code. Thank you again, Dr. Gomez, for this subject and this amazing event. Thank you. Thank you for inviting me. And I think my information is here somewhere. If anyone wants to communicate with me, ask me about anything or more information.